I want to welcome everyone, and we're glad to have you join us today for this session of the NNLM Virtual Symposium on Health Misinformation. I'm Carolyn Martin, and my pronouns are she and they. I am the Outreach and Education Coordinator for the network of the National Library of Medicine, Region 5, which is located at the University of Washington at the Health Sciences Library in Seattle, Washington. We'll try that again. We have just a few technical items to cover. All attendees have been muted, but we do welcome your questions and comments in the Zoom chat at any time. VFairs is providing technical assistance today, and the NNLM staff will be keeping an eye on the chat with me. But please be sure to select everyone from the drop-down menu when posting your comments in the chat to ensure that everyone sees them. You may submit questions for the speakers using the Q&A function to ensure that they do not get lost in the chat. We have live closed captioners for this event. You can access the closed captions by clicking on the icon, Show Captions. And if you would like to share on social media, we encourage you to use the hashtag for the event, HealthMisinfo NNLM. The National Institutes of Health is the nation's leading medical research agency. Many of you may be more familiar with the National Cancer Institute, which is one of the many institutes and centers at NIH. NLM, or the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It is the world's largest biomedical library and produces online resources such as PubMed and Medline Plus. The NNLM is the network of the National Library of Medicine and is an outreach program of NLM, working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. It is my pleasure to introduce this session's speakers who will be presenting about the collaboration to support San Diego County's efforts to counter health misinformation in the community. Margaret Henderson is a health sciences librarian at San Diego State University, and Tricia Lantzy is the health sciences and human services librarian at California State University, San Marcos. So welcome, Margaret and Tricia, and I'm going to go ahead and turn it over to you now, and I'll stop sharing so you can start sharing your slides.
Thanks, Carolyn. Let me just get my sharing going. And I hope everybody can see the screen. So this is our an overview of the project that we did here in San Diego County with a group of libraries that we ended up calling the advisory team for the San Diego Health Information Partnership. I'm Margaret Henderson, the health sciences librarian at San Diego State University.
Hi, everyone. My name's Tricia Lantzy. I'm the health sciences and human services librarian at Cal State San Marcos.
And first, our land acknowledgements. For millennia, the Kumeyaay people have been part of this land. This land has nourished, healed, protected, and embraced them for many generations in a relationship of balance and harmony. As members of the San Diego State community, we acknowledge this legacy. We promote this balance and harmony. We find inspiration from this land, the land of the Kumeyaay.
And the CSUSM land acknowledgement, just for reference, San Marcos is in kind of northern San Diego County. We acknowledge that the land on which we gather is the traditional territory of the Luiseño Payacuichem people. CSUSM and its surrounding areas are still home to the 6 federally recognized bands of the La Jolla, Pala, Pama, Pechanga, Rincon, Saboba Luiseño Payacuichem people. It is also important to acknowledge that this land remains the shared space among the Cupeño, Kumeyaay, and Ipai peoples.
So we thought we'd start off with some information from you, some examples from you, the audience. So please join in the chat and share some of your examples of what you have seen as examples of health information in action through the people you work with, whether it's patients, patrons, students, any experiences you've had. If you could just put it in the chat to everyone, we'd love to be able to see it and see what you're dealing with. So we'll give you a couple minutes for that and see what you have. I know I deal with it. Yeah, ivermectin is the first one that comes up. Yeah, we have horses, and it's been very hard to get ivermectin over the last couple of years. Oh, essential oils. Yeah, having asthma. Yeah, those are some good examples. Oh yeah, cinnamon for diabetes, definitely. Those are things that's really hard to. There are all sorts of interesting ones there. And so I guess after looking at those, the next thing is, how did you address it? What did you do when you had somebody talk about that kind of misinformation? How did you try to help? I know we saw in the Surgeon General's, the first talk, the Surgeon General's toolkit, there are various ways to help address it. But yeah, that masking is definitely. So a couple minutes, any ways that you address if somebody comes with misinformation? It's always difficult as a medical librarian to know how much of a person I think when I hear health misinformation. Yeah. Yeah, that's a good idea, Marie, to ask them how they know about that, trying to get to the source of where that information comes from. Okay, some of those have been great things, and I'm very glad everybody's been sharing those. It's been great to hear that. So I'd like to, Tricia and I actually will go through the process of what we did to develop something that will help with the addressing health and misinformation. And while it's something that we're all familiar with as librarians, especially those who work in consumer health, the start of the COVID pandemic in 2020 and the World Health Organization declaring an infodemic that same year brought the issue to the forefront. And our impetus as a group for taking on this problem with the decision of the San Diego County Board of Supervisors to declare health misinformation a public health crisis in August of 2021, the first county in the nation to do so. The supervisor's goal was to highlight accurate medical information and discourage people from heeding inaccurate or misleading information. This decision was made as people continued to complain about pandemic restrictions and resist vaccination efforts here in the county. This declaration had several recommendations, which included identifying and labeling health misinformation, examining gaps in health information, documenting sources and impact of misinformation, developing digital resources and training for health professionals, and working with the medical community to develop websites. These recommendations were based on the Surgeon General's advisory confronting health information that was in our first talk this morning. In San Diego County, there was an existing group of public libraries and academic libraries that collaborated on resource sharing. The circuit library directors met regularly, and after the County Board of Supervisors' decision, they decided that collaboration to support the efforts to combat health misinformation was important. Just as an aside, you might be thinking there are quite a few universities and 2 public library systems. How big is the county? The county of San Diego is the southwest corners to California, bordered by the Pacific Ocean on the west and the border with Mexico on the south. It is larger than Rhode Island and Delaware combined, and is the second most populous county in California, 5th in the United States. It is a very vibrant and diverse community. One of the library directors, Eric Mischel from UC San Diego, was the project manager, and he also reported back to the rest of the circuit library directors. Jeff Liu, the clinical librarian from UC San Diego, was our team lead. Their work planning and preparing for meetings made everything run smoothly. And I can tell you from working in team things regularly, I did not dread this. It was actually a very fun project to work on. Each organization that was in circuit is represented by health sciences or adult services librarian, although over time there were some changes based on people's schedules and interests. And we had an intern for part of the project who I supervised as well. So the background: over the first few meetings, the group considered the various things that could be done to further our goal, which was to combat health misinformation and provide reliable health information for our community. And then we tried to narrow things down to what the group could effectively do in the year we were given as our initial charge. The listing on the right of the group's aims was developed through an inclusive participatory design process. And I'd like to show you a short video that was part of a video given for the pre-recorded project briefing series for the Coalition for Networked Information, CNI. And this is Jeff Liu explaining some of this design process.
On an advisory team of 9 librarians to design and plan our health information initiatives. Our team includes representation from all 6 libraries in San Diego Circuit. Here's our process. First, we analyzed recommendations for mitigating health misinformation. Focusing on guidance from San Diego County and the Surgeon General, we identified 4 action areas that resonated with library work. They include information sharing, educational services, community engagement, and strategic partnerships. Next, we brainstormed health information initiatives for each action area. We generated ideas at individual and team levels to surface our different perspectives and organizational values. We strived to accommodate these differences in our planning. Afterwards, we prioritized high-impact initiatives that have a high ease of doing. We conducted multiple rounds of scoring and voting on the proposed projects. An essential element was graphing our ratings on a 2x2 matrix of impact scores versus ease of doing scores to focus on those projects in the top right-hand corner. Next, we collaboratively drafted project plans for each priority. Finally, we presented our project plans to the library directors of all circuit organizations for review, revision, and approval. We checked for mutually beneficial and complementary work across our different organizations throughout our design process. Consequently, each library has the necessary resources, expertise, and mission alignment to succeed in this work. Our planning resulted in 8 prioritized initiatives to carry out in 2022. We will present these initiatives in a logic model. A logic model can show the relationships.
Okay, and that was Jeff, and here is the logic model.
On an advisory team.
All right, there we go. Here is the logic model. You can see the resources that we needed, the activities that we had, the outputs for those activities, and then we related them to how they went with the recommendations of the county. So the A initiatives are things that can be done by the advisory team. B initiatives were for the circuit library directors, since these projects require higher administrative and collaborative capacity. The rounds of voting and discussion mentioned in the video took place in the fall of 2021. We were thoughtful about the resources we would need to accomplish our desired activities. You can see we needed people, funding, technology, organizational support, and contact within the community. All the activities were linked, as I said, to their impact, which was based on the county goals. And I wanted to show one thing about how we did this, just so you can see. So for the promote health information and resources, the A1, you can see we actually had several different deliverables we considered about how to do this, the roles and responsibilities, the resources. So we really thought through everything on this. This plan was presented to circuit library directors in January 2022 and approved, so we immediately went to work on developing a shared subject guide for health resources, which is this A1. and setting up NNLM training for county library workers for the end of April, which was A2. Since several of the activities required referral to reliable health information, we started with the guide. The guide is hosted at SDSU, since that is where the resource sharing website for Circuit was hosted. Each page of the guide was developed by different pairs of librarians on the team, and the information was then copied onto the guide by Jeff, our library intern, Sarah, and me. So I'll take you on a short tour of the library guide. Okay, and yes, thank you, Tricia, for the link. So here it is, the San Diego Circuit Guide. There's some really basic welcome information on the first page, giving people some really basic sources to start with, getting guidance with trusting the information or visiting the library. So these links to the pages within, and then finding support within the county as well. So we included all that on the first page. The second page, health information. You can see that we had all sorts of different conditions that we had. We chose things that were going to be important in the county that we knew of from the work that we had done. I worked with the School of Public Health at SDSU, and so I worked with a lot of students on different projects based in the city. That's one of the things about the public health program, is they do a lot of work in the community. So we worked with that. We also had contacts with Health and Human Services, which is why we ended up with monkeypox on there, because that was a big problem here. So this whole guide gives information, different languages where possible. And I think the other thing that I was really concerned about getting on there was how we picked resources, which was one of the things that I think was important, so that people could see that we actually use some sort of structure to be able to decide which resources were reliable to be able to put into this particular guide. So this gives people one click into different aspects of each of the health conditions that we have included on here. The original guide had this page, can I trust the information? Avoid health misinformation, I'm not going to show you because that's part of the second part of our project that Tricia will show you. But this was very basic information based on the Surgeon General's guide, but also based on other things that have come from the National Library of Medicine, CDC, different groups like that. And you can see we have references to where these things come from on each of these pages. So just really basic stuff that, again, you saw something similar this morning when you heard about the Surgeon General's report and the Surgeon General's toolkit. And then, you know, these kinds of things that that you should do when you hear that kind of information. So we had a page on that. Another important part was look what you can get from each of the libraries. So each of the libraries in the group, we gave information on visiting the website, how to use the library, special recommendations of what that library might have that are useful for people in the community. Then also, because we did the library worker training, the information was here for that again, and where they can make health referrals, some guidelines for doing health reference, training opportunities, and then this was a video of the NNLM session that was done for San Diego County. And so that's available as a video in there. And then finally, of course, an about us. Important part of any website is to let people know who we are and why we are sharing these credible health information. So you can see this gives a whole outline of the project, similar to what I've been giving you. So that's the information from the circuit guide. And so we'd like to go on then with another chat question. Now that you've seen the kind of things we've been looking at and using with the people, what is the most common online resource that you like to give to people for finding reliable health information? And it's perfectly fine if everybody says Medline Plus. I see it coming up already, but we'll give you a couple of minutes to put things in there. If you have something else besides Medline Plus, that's great too. But I know that was something we relied on before that. So, and at this point, I'm going to stop sharing, and Tricia's going to set things up with her section.
Perfect. Thank you, Margaret. Okay, it should be back up there. All right, PubMed, Medline Plus, FDA fraud scam site, Medline Plus, Kids Health, awesome. These are all great. Vaccine Resource Hub, awesome. Thank you so much. And I did see there was a question in chat. Margaret, there was a question about how often will this guide be updated? And I don't know if we've discussed that. I know this guide recently came online.
Yeah, I think the big thing is that's one of the things as we have our next meetings of the group we have to discuss is, you know, where's the schedule going to be. I would imagine because it is LibGuides that are at SDSU, it's going to be something that we have to sort of you know, put on our schedule and then ask the group to help whenever it comes time to do some updates. But I would hope, given the way links are, I would hope every 6 months to a year. But well, Tricia will get more into what the group's going to do moving forward.
Yeah, absolutely. But that's a really good question, and actually something good for Margaret and I to bring up with the group.
Yeah.
Like long-term planning. All right, let me check on the chat before we move on. CDC, WHO, and Medline Plus. Yep, all of these are the classic stuff that you will see on the guide as well. So once the Find Reliable Health Information Guide was published, we did do kind of a promotional push through all of the participating circuit libraries. This looked a little bit different depending on the library. So for example, at CSU San Marcos, we had this image you can see on the screen, one of our library spotlights on the website. We also all shared through our social media accounts, our Instagram accounts, or Twitter for the various libraries. SDSU collaborated with Student Health Services to share the guide with students. I also used the guide for some of my public health students at my university. So there was a kind of a wide variety of how we promoted our guide, depending on what made the most sense for the library that we are in. In the community itself, we actually have, we got the Escondido Grapevine, which is just a local newsletter to kind of share the promotion that UCSD put out. So that was really nice that it kind of went into like the local news so that we can kind of spread the reach a little bit more for the guide. Now, as a result of all that guide promotion, our guide has a bit over 4,000 visits so far. And hopefully that will just, oops, sorry about that, increase as we share with you all today. So the next project for our team was an online outreach toolkit for addressing misinformation. This project was funded by a $25,000 grant to UCSD and the circuit team from the National Library of Medicine. And that grant was called Building Resilience to Health Misinformation in San Diego County, California Communities, an online outreach toolkit for library workers. The goal of this kit was to help San Diego County workers in public, academic, and school systems launch an online campaign to address the spread of health misinformation. So this kind of helps spread the impact of our work by engaging the public on multiple platforms through multiple institutions. Using a lot of the content that we created for that Finding Reliable Health Information Guide, we were able to kind of repackage it into a toolkit with customizable fact sheets, social media, sample messages, and best practices for an online public education campaign. So if your institution had never done something like this before, there's really very clear step-by-step instructions. I'll kind of show you that in a moment. And of course, in terms of an online public education campaign, we felt like this really made the most sense and tied very closely to health misinformation, because of the way health misinformation spreads, which is very, very much an online thing. I'm sure it happens with word of mouth as well, but we can see the spread through the online method a lot quicker. So we felt an online public education campaign made the most sense to address that. And the content created teaches techniques for evaluating health claims, finding reliable sources, and responding to misinformation in an ethical and productive way. I found that part, that content, how you respond to health misinformation, to be very, very interesting and helpful. And it was exciting information to put together. So let's do a quick tour of the library toolkit. And Margaret, if you can put the toolkit link in the chat for folks. Okay, so here is the toolkit. It has some of our information, why we're doing this. The content provides, the toolkit provides content for you to adapt and share. And then you have what is on this page. So if you look under the how to use this toolkit, it shows we have fact sheets, sample messaging, and videos. The fact sheets are in 10 different languages, but I really want to point out that we have a Creative Commons license on this, so folks can adapt and share the content in a way that makes the most sense for your community. I did want to show an example of the fact sheets. So we have several different fact sheets. They're in English and Spanish. We also have coming soon, the fact sheets will be available in 8 different languages in addition to English and Spanish. So we did have these up, but they're being reformatted to better match the PDFs in English and Spanish. So those hopefully will be added very, very soon. And here is an example of what one of these fact sheets look like. So these are things that can be printed, it can be sent through social media, posted in blog form, all kinds of ways. And I wonder if we have, let's scroll down. So here's the how to find reliable sources of information and how to stop the spread of health misinformation. So there's a variety of different fact sheets here. Sorry about the scrolling. We have sample messaging and images for social media. And I just like looking at examples here. So for example, Twitter sample messages. You can see there are some examples here in Spanish as well. So it really does do a lot of this outreach work for organizations, and then organizations can just change little pieces of information based on what fits best with their communities. There are video summaries of the fact sheets, so short, they're like 3 minutes, I think, that kind of summarize the information on each of the 4 fact sheets. And then here is the section about launching an online campaign, which I feel like is very helpful, especially for organizations that may have not done this previously. Ways to share the fact sheets. And then they provide some hashtags for ways to kind of tag the content that they're sending out to the community. So please take some time and look over this. This is, I feel like, a really big accomplishment for our group and a really nice kind of leap from the guide to this outreach campaign. Let me get back here. And since we launched this library toolkit website, we have a little bit over 1,500 visitors so far. And that is probably because of some of the promotion we've been doing. We mimicked a lot of what we had done for the Find Reliable Health Information Guide in terms of each library sharing through social media. So you can see on this slide, the San Diego County Library's Instagram post that has a screenshot of one of our fact sheets. We will actually have physical exhibits for the fact sheet posters in the summer of 2023 for both UCSD and CSUSM. So students walking through those areas of the library will be able to see the content. UC San Diego, of course, did another press release of the toolkit, and that press release was shared by the Association of Research Libraries News. And the thing I am most excited about is we had some leftover money from the grant we were given for this toolkit project, and we were able to buy bus stop advertisements. And there is a picture in San Diego County of a few of our bus stop ads, which just went up. I think we just got these pictures last night from Missy from San Diego County. So those two are really the big projects, the guide and the toolkit, but there are other things we've been doing in this group throughout the time we've been meeting. I believe we coordinated or helped coordinate. I was on leave during this time, but the NNLM Region 5 conducted a health reference training for all library workers in San Diego County. And we also collaborated on a reproductive health information author event at San Diego Public Library. Okay. So this was an extremely unfrustrating collaboration. Margaret has already shared really how well the group worked together and how streamlined it was. The collaboration was designed around the 5 conditions of collective impact. So those are shown here as a common agenda. So structured meetings with requests for feedback. Eric and Jeff were really great about sending the agenda out ahead of time. We were able to add things to the agenda at any time. So it didn't feel like you went into a meeting and what are we doing today? It was very, very structured. We have this shared measurement system, participated in mutually reinforcing, activities, and there's continuous communication among the group members. And one of the most important things to me, I felt, was the fact that there was a lead organization. So there was someone who was putting the stuff out, putting the agendas together, getting feedback from the group and kind of walking the collaboration through. And I felt that was a really important piece of this collaboration. Also helpful was the group design activities and the participatory nature of those activities. So I think someone mentioned in the chat, it's nice that they asked you, what activities we should be participating in and didn't say, these are the things this group is doing, go do it. It was very participatory for the librarians involved. And there was full support of the directors and deans of the libraries. So I think that was important as well, because this did take work, and having that go ahead from the deans and the directors made a big difference in what we were able to do as well. Okay. So here is a moment that we can kind of reflect on this form of collaboration and maybe think of some ideas for you, for where you are, what kind of initiative could be supported by this type of cross-library group, such as the San Diego Health Information Partnership. Do you have ideas that, would make sense for this type of public library, academic library collaboration? So let's maybe just take a minute or two, maybe until 11:06, to let people think and put stuff in the chat. Or are there any topics you could see this type of collaboration moving into? Pre-diabetes and diabetes management, social justice initiatives, absolutely. Anything else? Public health workshops on popular topics.
And the public health workshops, I must admit, Missy Solis, who I think I saw there, who is our public health, county public health person or public library person, they regularly, I love my county library system, and they regularly have people from Health and Human Services come and give talks. During COVID, they had doctors explaining vaccines. It was great. So yeah, I think that definitely is something that is good to do.
Yep. I love all these ideas in the chat. We literally just went through this process as a group, I think in our last meeting, and it took us some time to brainstorm, like, where do we go from here? What are some ideas? So this is part of the reason why we were asking you as well, because we've been thinking about this. Awesome. Yeah, all those ideas are so great. Our potential plans that we discussed last time we met was the idea of broadening or pivoting the scope to other forms of awareness. So a lot of your examples, I think, would fall into this category. One specific idea that came up was the idea of climate change and environmental health, and spreading information about topics in that area. Broadening our community engagement strategy. So thinking about how we can use our networks for other forms of information sharing and collaboration. Bringing health information topics back into the library. So for example, library programs that address overdoses. I think, like an example, the caregiver workshops idea might fall well into this category. So like, how do we bring these things back physically into the library? And then addressing the basic needs of users and collaborations to increase awareness of these issues and highlight community resources. So these are some ideas that came up during our last meeting when we were kind of brainstorming our next steps. Okay, and that brings us to the end, unless I forgot anything. Margaret, do you have anything to add before we open up for questions?
No, I can't think of anything at this time.
Oh, I did want to bring up the directors actually did meet recently after we had this conversation, and I think we're probably going to be doing this first bullet point where we're kind of pivoting the scope and continuing our collaboration into next year. So there will be more on that to come, but it's been a really great experience, and I feel very lucky to have a relationship with all these librarians, the public librarians, and my counterparts like Margaret at other universities. It's not something you always have automatically, so it's been really nice just to know like local librarians working on similar topics around us.
And I think it's nice that the whole group doesn't want to stop working together. We all want to continue on with this project. And I see a couple of people mentioning school librarians. And yes, through contacts they have at UC San Diego, they know somebody in the public school system who is putting the fact sheets and that kind of thing into those librarians so that they can start to use those fact sheets with the public school level students as well.
And that's the great thing too about the fact sheets and all the content for that outreach toolkit is those school librarians could potentially, modify the wording and modify the information so that it's more at the level of whatever grade level they're working with. So yes, and it's also, speaks to the fact that we have that network in this group, right? So like, I don't have a contact with school librarians, K through 12, but was it Missy, Margaret, who had that contact?
I thought it was Eric, but
Eric. Okay. Yeah. It's the power of, having a big group together with different networks and what is possible. All right. Well, thank you so much. And we will take a look at the chat and see what questions we can answer.
I see somebody has asked about involving school district community college librarians in the advisory committee. I don't think so much in the advisory committee because that's that's just the circuit group. But we are reaching out to all the other librarians in the county. So we have a San Diego County Health Librarians group that involves all the hospitals. Jeff and I have been sending things out to that group regularly. So, wherever anybody has a connection, the public libraries have been sent, because there's a couple of other systems that aren't part of the county or city. And so they've been making sure they get included in things. And so we are trying to include other groups and bring them in to at least share the information around the county.
Any other questions?
Well, while people are thinking about some questions they might have, and again, you can put those in the chat or in the Q&A so that they don't get lost in the chat, although I think we don't have a huge number that we have to worry about that. But, you mentioned what a pleasure this was and how wonderful it was to work together. But to me, it seems like a huge endeavor and lots of different people involved. How difficult was it to divide the work and to figure out what you wanted to focus on and who did what?
There we had rounds of voting. So we do things like brainstorm something. And then like Tricia said, one of the things that made it useful is that Eric and Jeff especially Jeff would pull things together. So he would pull things together and see, okay, these things are similar. Let's group them together. So he'd take this long list of brainstorming, fix it up so that it was a smaller number of things that we had to work with, range it into those different groups of ways we wanted to have impact or things that were suggested by the county. And then we just voted on it. Everybody looked at things and said, oh, this is most important. Everybody had a chance to vote. Everybody voted on different things, but then we ended up taking, what had the highest votes. So we had time in between sessions to do the voting, during sessions to do the voting. We did round robin things where people would make comments on different ideas and take turns being the only one in that part of the document to do it. And then we'd switch. So everybody got to have their comments seen and heard as people went through it. And so it was because, yes, there was a certain amount of organization provided by Eric and Jeff, but everybody participated in it in the meetings. The meetings were very well run. And so that made it so that everybody could have their say. And the voting really made a huge difference.
And we did just really have a very participatory group. So when we created the guide, we split the guide content based on those tabs that you see on the guide. And, people just volunteered, like, I'll write this section. And, it was it was never hard to have a volunteer for getting some work done. And then each section would go through, like all members would go through and make comments. So it actually didn't feel like a ton of work.
No.
Amazingly, even though a lot of work has been done by this group, I feel like we really did a lot of foundational stuff kind of right off the bat. And some of the later stuff is just kind of rearranging that information that we had already kind of put together. So it didn't feel like a lot of work, but this is also another reason why it was really helpful to have the support of the deans and directors, is so that they understand that there is a lot of work going into this, and that work is visible, it's not hidden. All right, I don't see anything in the Q&A or anything in the chat. Okay.
I have another question for you. You cover a lot of different topics in this guide, and I was wondering if there had been any negative feedback or reactions from the public or whoever regarding any of that, or even just about COVID. I mean, because these are kind of controversial topics in some communities.
No, I have not gotten anything from it. Unless one of the other librarians has had people commenting through them, but I have not had any comments.
Yeah. Yeah, CSUSM has not received anything like that, I don't think. I think there might have been, I think San Diego County might have gotten some comments surrounding the reproductive health book event, but nothing that stopped anything from happening.
And Oscar, who was the person from the city public libraries, he expected there to be comments. I mean, he was very passionate about having this reproductive health event because of all the things that have been going on with access to reproductive health care. And so he knew what would happen. He knew there would be protests at the event. Everything was prepared for. And so, but that wasn't a true group event because one of the universities didn't participate, but the rest of us did. And I got one comment on that event from somebody in the library. And again, the rest of it has been very supportive.
Yeah. And it really, I was just consistently amazed by the work our public librarian counterparts are doing. And just, we have very different day-to-day activities, I feel like, in some ways. And so it was just really, it's been so interesting to work with our adult services librarians in San Diego County and just see like the amazing stuff they can put together, especially when it comes to events and reaching the public in these ways. It's been really very cool.
Yeah, I agree. I have nothing but the greatest respect for public librarians after that. Like it's like, no, you guys are great. I'm going to let you guys. It's just so much. It's just so much.
Mm-hmm.
Well, I don't want to cut anyone off, so if we'll give you another minute if you have a question that you would like to ask our presenters before I share our final slide with some additional information. Got a thank you, which is great. This has been a great presentation, a great topic.
Thank you all so much for having us.
Thank you.
Sure. Well, thank you. We really appreciate it. Let's go ahead and I'll have you stop sharing your slide and I will share our last slide here. So thank you again, Margaret and Tricia. This was really an informative and exciting project that you did, and we really appreciate you took the time to come and share that with the rest of us. So we just have a few items regarding before we end this session. If you are interested in receiving the Medical Library Association CE, for this session and for others of this symposium, you will receive an email after the symposium ends with a questionnaire and instructions to claim CE. I also want to encourage you to join the network of the National Library of Medicine. Membership is organizational and not individual, but it offers benefits such as funding opportunities for projects like this, and as well as print resources and opportunities to participate and join us in our work. We have about, I think about 40 minutes until the next session. So we want to encourage you to take some time to visit the booths in the exhibit hall that is part of this event. And then also consider taking a break away from the computer, stretch and step outside for a moment. But we want you to also come back and join us in some additional sessions today. And we want to tell you that the next group of sessions starts at 3 o'clock this afternoon on Eastern Time. So thank you again to Margaret and Tricia, and to all of you for attending, and for Margie, Veronica, and Bernicia for participating and helping bring this session to you. Thank you.